You're listening to The Audit presented by IT Audit Labs. My name is Joshua Schmidt, your co-host and producer, and today we're joined by the usual suspects, Eric Brown and Nick Mellum of IT Audit Labs. Today we're joined by Ed Gaudet from Censinet. So we're going to be talking about ransomware and how that's affecting patient health. I know Ed you've done a lot of work with that. And so more specifically, when ransomware attacks hit a hospital, most people think, it's mostly about stolen data. But patients are actually being impacted by these attacks. So we're going to get into that today. And without further ado, I'm going to turn it over to Ed. Can you give us a little background on yourself, Ed, and what you've been working on?
Yeah, thanks, Joshua. Thanks, folks, for joining the podcast today. I'm Ed Gaudet. I'm the CEO founder of Censinet. And I guess you'd call me the serial entrepreneur, although I hate that label. People are so much more than the labels, right? But I've been at tech and solving problems with tech since I graduated college. So it's been a long, strange trip, as they like to say, in the wonderful world of the Grateful Dead, Joshua. I thought I'd throw that in there.
A little shout out to the song.
We talked a little bit about that earlier. Yeah.
It's speaking about connections. Eric just joined you on your podcast, Risk Never Sleeps, which you aptly named after the Rust Never Sleeps Neil Young record, I believe.
I did. Yeah, I did. I was thinking about a way to personify risk, and especially in healthcare, it's 24/7, right? It's the bank. It's not a bank. It doesn't close right after 5. Patients are coming in at all hours. Care is being delivered at all hours. So risk is always there. It's always on. It's always present. And when you think about the personification of risk, people, we eat, we sleep, we work, we play. This notion of sleep was really interesting and pertinent because risk never sleeps. It's always there. It's always on.
Well, I'll start out here with a little statistic, then I'll turn it over to Eric and Nick a little bit here. But you shared with me that, from 425 incidents impacting 27 million people in 2020 to 592 incidents affecting 250 million in 2024. What's driving this explosive growth in healthcare targeted attacks?
Well, I think the bad guys are following the money, right? It's the old adage, go to bank robbers, steal from banks because that's where the money is, right? So it went from data theft, which again, it's a problematic, especially finances figure out a way to make people whole if they lost their identity. But in healthcare, it's a little different. If your data's out, your data's out. Sort of hard to get that genie back in the bottle. And that was all good and well until right around 15, 16, we started to see this thing called ransomware occur. And it was the ability of the attackers to actually shut down the operations based on the data. So locking up the data in a way that was unusable, so therefore you couldn't operate. And today, most everything is digital when it comes to patient care. And this notion of locking out doctors and nurses and clinicians and administrators from delivering care becomes a real problem, especially if you're 24/7, 365 days a year. You've got people that are getting ready maybe for surgery next week or the next day or in a couple of hours, or somebody's coming in via ambulance and they can't get into the health system. And maybe that health system is in a burgeoning city. So the next one is maybe a mile away or 2 miles away. But if you're somewhere, out in the country and the next available hospital is 2.5 hours away, that's a problem, especially if you're the one in the ambulance having the heart attack, right? Minutes mean muscle, and muscle means lives. So we started to look at it, and we started to, again, anecdotally believe that ransomware and these attacks and these incidents, events were causing patient harm. But no one really could point to any research, qualitative or quantitative or otherwise. So we, back in I think it was actually during COVID, we approached the Ponemon Institute. You may know of them. Larry Ponemon does a lot of research on the cost of a data breach and the cost of a data record stolen. And I had this thesis that, hey, there's more happening within the healthcare environment than we know. It's not just the data theft. It's actually impact to care. So let's qualitatively study that. And so we built out a research study that literally showed if a hospital had a ransomware attack, they were getting some increase in mortality, or they were getting diversion of care coming into an ambulance, or they were canceling labs or other procedures. We were seeing this data and realizing, holy cow, qualitatively or otherwise, directionally, something is happening here. And then I think we published that on a Wednesday. I got a call from Josh Corman over at CISA, and he's like, what's your methodology? I shared it with him. He said, we're publishing a study in 2 days, which is quantitative. It'll back up what, you're finding. So that's when we realized, okay, we've got a big problem here. Right then we realized this is more than just data. It's about lives, saving people's lives. And it became personal because everyone has been a patient, or they have a family or a friend or a mother or an aunt, sister, brother, friend hooked up to a life-saving device. And you definitely don't want a ransomware attack on that hospital or that device.
How do you, in your point of view, how is the healthcare industry cybersecurity different from outside healthcare, whether it's OT or, private organizations, a school district per se? Is there a big difference between those two areas?
Well, I think if you compare it to traditional industries, and again, having been through creating products for many different companies and focusing on many different industries, I've always looked at healthcare as late adopters of technology. They used to be 5 years, behind everybody else prior to 2009. And then in 2009, the Obama administration passed the HITECH and the ARA legislation, which provided really a forklift upgrade from a technology infrastructure to these healthcare organizations. And they were able to really digitize all paper-based processes, right? Care, delivery, which is on a paper chart, went to an electronic medical record or an EHR, an electronic health record. And everything else around that supports the electronic medical record was also digitized, right? And so now you went from being able to not worry so much about downtime of servers or your network or your infrastructure to, wow, if it goes down, we can't deliver care. And it was in a very short period of time, 2009 to, I'd say, 2019, really, that 10 years was a very transformative period for healthcare. Whereas it took, everybody else sort of at the pace of the technology, right? Healthcare had to catch up. So you had sort of that compression of that infrastructure update, the transformation of all those processes now onto electronic systems. And then you throw on top of it the introduction of ransomware. It's the perfect storm.
And Ed, I spent some time in healthcare over the years and doing some of those transformations of systems going from paper to tools like Epic. And the ICD, or the International Classification of Diseases, was that ICD-10. I think ICD-10 is the current version of that. Yeah. And interested on your take on this, but what I learned about that was largely this transition from paper to this electronic health system. Yes, it benefits the patient. It makes data portability easier. But also it is really the benefit of insurance. And these ICD codes are billing codes that insurance uses. And there's, you can search on the internet. There's some pretty funny ones out there, like encounter with a duck, or I think there's like initial bite from a pig or something like these different codes. And there's thousands of codes that essentially care is provided, and then the care that the person receives is codified, and then that helps insurance
with reimbursements. Exactly, you're spot on, Eric.
As you think about it, when it is absolutely wonderful that as a patient I can log into a portal and I can get information about the care that I just received. I can see the doctor's summary and all of those things that I think insurance has driven a lot of the technology advancements. But with those advancements, as you say, in the healthcare space, introduces a ton of risk. And we've seen over the years millions of records exposed in ways that they really shouldn't have been if they had been protected with due diligence.
Yeah, that's right. And I feel in some ways, we made such progress on the threats around ransomware, and now we've got a new threat, which has exponentially opened up the attack surface, called AI. I'm sure you guys have heard of that. So, yeah. So, on one hand, we wouldn't be able to realize all the benefits of AI hadn't we gone through the process of getting everything on digital in electronic form, right? Whereas today, because everything is digitized, we can, from a care delivery perspective, we can really start to incorporate AI into those workflows, into those use cases, to deliver better care outcomes. We always talk about that and applying technology to do that. But for the most part, I would say over the last decade or two, we've really been, paying our dues, if you will. It's been more painful than it has been more of a process of healing. I feel like we're starting to go through that now. But with AI, there's a huge promise around the advancement of technology. The problem is that it exists within the context of all of the products and services that we currently use that are in inventory, right? And some of them we know about, but most of them we don't know about. I remember when Adobe, turned, I don't know if you guys went through this, but all of a sudden Adobe's got AI in the product. And I'm like, what the hell? I'm trying to turn it off. I can't find the actual X. There's no X to turn it off or disable it or anything. So I go on Reddit, and Reddit's like blown up. It's all red, right? It's all about, they're just slamming Adobe for turning somebody to fall. They eventually recanted and they made it optional. But man, it was brutal. I had to uninstall it because we're a security company.
Yeah.
I couldn't risk having, Adobe do whatever it was doing. I had no idea what it was doing. That was the point, right?
Mm-hmm.
And so I immediately took it off my system, and then I monitored it. And then, shortly thereafter, they did the right thing, which is good. But Microsoft's doing the same thing. Shame on you, Microsoft. Like, you're doing the same. I turned you off, and then you turned yourself back on. What the hell? Why are you doing that? What is wrong with you, right? It's right. It's a big, Nick, it's a huge issue. What do they do? Why are they doing that? Do they not learn? But sure enough, they don't learn, right? So you imagine that's just on our own laptops, right? Imagine you're a health system and you have to manage thousands of nodes and endpoints and laptops and devices, and both personal and professional, and they're turning it on and turning it off, and all hell's breaking loose, right? That's what the CISO and the CIO are dealing with today on a daily basis.
I think the issue that we had, if I remember this correctly, it was at a client, and they're obviously a Microsoft shop, and Microsoft's migrating MFA. And I don't have all the details in front of me right now, but we had the text option turned off at the client. So you couldn't receive the code through the text, and you had to tell a specific time to migrate, right? We had all that in place. The migration was basically done, but it hadn't been turned on yet, right? Because we weren't quite to the point. Microsoft on their own turns back on the text messaging option, and that somebody did do it, and a phishing email, they used that login to get into their personal Gmail on a company computer, received an invitation for a luncheon, and they clicked it, went through. So we had an issue there. But
it could be worse.
It could be worse.
It could be worse, Nick. We could be at a Coldplay concert with our HR director.
I was wondering if that was going to come on.
Sorry, I had to do it, guys. I'm sorry.
That was
too soon. Too soon.
No, perfect timing.
The power of the internet, right?
Ed, you talk about Microsoft turning on and turning off things. Recently ran through this with a customer where they went a different direction than the Defender product suite, which Microsoft is trying to cram into everything. And that thing is like a virus. They went with a Palo Alto solution.
Yeah, it's a real problem. I mean, if you're going to be secure by default and secure by design, right? Then by default, and this is, we learned this lesson. We obviously, like everybody else, we took a look at AI when it came out. I mean, it's been around forever, right? We've used it in certain areas of the product, but never like generative AI or like agentic AIs today. So we looked at that, when it came out a couple of years ago and said, okay, this is game changer, but we have to figure out how we build it in because we're not like everybody else. We have a fiduciary responsibility to our customers to not just force them to adopt AI like I went through with Adobe. So how are we going to do it? So we built it in. We partnered with AWS. We did a self-contained approach to the infrastructure and to the architecture. And then we enabled customers by default. It was turned off, and on demand, if they wanted one or they wanted all or they wanted some combination, they could turn on those capabilities when they were ready based on their ability to consume that. And that's really what customers should be getting. And that's what vendors should be delivering to customers, not forcing these on by default, which is disastrous, right?
Well, in that Defender, like you've got Defender for Office, you've got Defender for SQL, you've got just all the Defender for 365. They just throw Defender in front of it, and then like a virus or turning it on behind the scenes, making it really hard to disable. And it was like, well, if they made a good product, hey, we'd love to turn it on, and use it, but it's just not a great product. And it's unfortunate that Microsoft has stepped so far away from the ecosystem of the Office suite and email management into all of these derivatives where they are certainly not the best in class. And it's really frustrating, like you say.
No, and they're using their customer base as a lab, right? They're turning it on to make it better because eventually, they'll figure it out, right? And they must do. They're smart guys. I've been out to Redmond. I'm out to Bellevue a lot. They're really smart, right? So someone's running a model. Talk about a actuarial model like the insurance company. Someone's running models that say, you know what? We're gonna benefit better if we know it's a problem. We know people are gonna complain about it, but guess what? The benefit's greater than the pain we're gonna cause. So we're gonna just do that. Otherwise, I can't understand why they're doing it. I just they're Microsoft. They don't need to do this.
It's a brilliant model though, because if their software wasn't so shitty to begin with, we wouldn't have to patch it constantly. I mean, look at the amount of patching that comes out for their nonsense month over month. Now, I got to buy your crap to begin with. And then I got to pay you to secure it as well, which is just ridiculous, right? So no, I'm not going to buy the Defender product. You're not going to just force feed me a truckload of your stuff.
That's right. But, on the other hand, there are worse vendors. So Microsoft, I am a happy user. So please don't make my life